So one of the tools that I've worked on that I think really helps is starting conversations. If someone, you said Nick, right, sir? Yeah, Nick says, I'm good. Then usually for me, I'm going to say, no, really. Like, for real. How are you? You might give me something a little more, right? Like, I'm really tired from the trip, or like,
yeah, I have a migraine and I'm nauseous. So I got my glasses because the light.
I feel that. And I'm so sorry that you're feeling that way. Thanks for sharing with me. You know, like but that's not what he's going to lead with if I ask him, right? Because it's not culturally appropriate for us to tell people all that stuff. But I can change the way I ask the question if I'm really wanting to know how you're doing, right? We can change our tone. And then if I'm concerned about someone or myself, but usually someone else, if I see that their personalities have changed, maybe they're more withdrawn, maybe they're more outgoing, maybe there's more agitation or anxiety, maybe they are pulling out of things, ways of communicating with others or participating in community. Maybe you're seeing that they're not taking their medications well, they're not eating well, they're not caring for their bodies in the way that you've seen them in the past, or you hear these signs and symptoms of hopelessness. This is big. Hopelessness at given hour, the way we think about this is a scale in which people that become completely hopeless are the ones that we worry about the most, because hope is what pushes us forward. We're going to end on talking about hope. But if I'm watching people around me and they are presenting any of these changes in behaviors, that's when let's see if this works backwards. Yeah, that's when I'll say, hey, Nick, I noticed you put on your glasses. Are the lights like affecting you? You know, if I know you well enough, like that might be my sign to be like, you want to go take a break? Can I get you some water? Is there anything that I can do for you, right? I've noticed, you know, hey, I've noticed, Tyrone, that you keep leaving the room. Like, are you okay? You know, or something that we're talking about, bringing up anything, you know, or do you need to make a phone call? Is there anything I can do to help you while you're gone? You know, like I've noticed such a gentle way, because it tells people I care about you, I see you, and I'm concerned.